Hi, Colette Barrett. I serve as the Vice President of Mission at Our Lady of the Lake Regional Medical Center and have the privilege to serve as the Chairman of the Board of the Mayor's Healthy City Initiative, or Healthy BR. The social determinants of health are those factors outside of what we consider health that have a significant impact on one's being well. Social determinants of health are often defined as your living space, your ability to financially care for yourself, transportation that you may or may not have access to, education that has prepared you for the work that you do. Many of those factors, the environment in which we live, work, and play, are what we consider the social determinants of health. Social determinants of health are really very, very important for our future focus around our community health needs assessment. If, in fact, social determinants of health were not a key factor, then Baton Rouge would be the healthiest community in Louisiana. For the last 8 years, we have been number one when it's considered access to care or access to health care. Of all the parishes, we have the best access to care. So if you have access, one would think that we automatically would be healthier, but that's not where we find ourselves. Genetics only play a 20% role in health, and so the other 80% have everything to do with social determinants of health. Economic stability, so that we have the resources that we need in order to have a healthy place to live in. Transportation, to be able to take us to health care. All of those aspects play into what we consider social determinants of health. Considering access to care, you would think that we would be a healthier community because expansion of Medicaid opened up access to healthcare resources for a significant portion of our population in our community, yet we still lag behind when it comes to access. Let's talk about the impact of food on one's health. We live in a community that is rich with food access. Many areas of our city have what's called a grocery gap, where our citizens have less than adequate, healthy food options. They do not live within a mile of where you can purchase fresh and healthy food. Therefore, we live in a food insecurity area of our community in quite a few places. Therefore, addressing food security and addressing access to care would be significant in improving the health.